Well, these days, you can't get a lot for $10 a month, especially with inflation. But in California, you can get something that can save your life. Health insurance through Covered California. Covered California is a state system for administering the Affordable Care Act, and it's time now for open enrollment. 1 million uninsured Californians are eligible. And Jessica Altman, Executive Director of Covered California, is with me live to share what's being done to get them to sign up. Jessica, good morning to you.
Good morning. Thank you for having me.
Definitely. $10 a month. It seems like this should just sell itself. 2/3 of the almost 2 million people already in the system are able to pay that price or nothing at all. How is it, do you think, we still have so many folks that aren't covered, even as we celebrate a decade of enrollment in the state?
Yeah, it's incredible. It's our 10th open enrollment period. Covered California is celebrating 10 years. And I think as you talk about the level of affordability that we can deliver, particularly after some of the changes we've seen from Congress, many paying $0, nearly a quarter of our enrollees don't have a monthly premium because it's $0. We are celebrating incredible progress, but we do have work to do. We do still have uninsured Californians. There are a lot of reasons that people are without insurance, but the one I want to focus on is when people think there's no way they could afford it, there's no option for them. And I want to stress to anyone in that position that there are options for your health insurance coverage here in California, that health insurance is more within reach than it ever has been before, and that now is the time to visit coveredca.com and explore your options.
Last year, President Biden's American Rescue Plan injected $3 million into California's economy to help people get the coverage they need, making sweeping upgrades to the program. This year, the Inflation Reduction Act is helping. There is a change this year with family coverage, though, right? It used to be that if you had access to coverage through your employer, you had to go with that, and the cost to cover your entire family wasn't a factor, even if it was more. And now the cost of covering an entire family can be considered?
Yeah, that's right. So, the promise of the Affordable Care Act is if you don't have access to affordable coverage from another source, you can come to the marketplace, you can come to Covered California, and financial assistance is available depending on your income. This change in interpretation really opens the door to families who may have employer coverage, but for whom that coverage is not affordable. And this is particularly, I would highlight a circumstance where the employer is providing a contribution or subsidizing the coverage for the employee only, but the spouse, the dependents, the other individuals in that household on that plan are not receiving help, and it's making it unaffordable. That's the group of people, and there are over 600,000 Californians estimated to be in this position who may now have a new opportunity to come to Covered California, get coverage, and also receive financial assistance that they couldn't before.
And as you mentioned, a lot of people guess that they won't qualify, so they don't even check. So it's important to just take a few minutes and look at the numbers. You can actually talk to a certified enroller, right? Somebody can walk you through this process, so you do not have to figure it out all on your own.
Absolutely. We have over 11,000 certified enrollers. There is likely one right now within 10 minutes of where you are, within 10 minutes of where you live. And the help that they offer is free. It is confidential. It is in whatever language that you need it to be. So please know you are not in this alone. If you'd like to find help in your community, there is the Find Local Help tool on our website, coveredca.com. If you want to do in person, if you want to do over the phone, we are here for you however you want us to be.
And quickly, before we run out of time, what, if any, other changes are coming to the system this year?
The biggest to highlight is that we have the Inflation Reduction Act, that the enhanced financial assistance is here for another 3 years, both increasing the financial assistance to those who are already receiving it and providing financial assistance to those middle-income Californians who previously were ineligible. And so we now have a promise here on Covered California that no Californian should pay more than 8.5% of their income for their health insurance on Covered California for our benchmark plan.
All righty, big day, celebrating 10 years of enrollment, and open enrollment for this year now open. Lots of ways to get help, lots of ways to get covered. Thank you so much for joining us this morning.
Thank you. Have a great day.